We now have an update on how the nation is preparing for and dealing with swine flu. Reports this morning that one ER at a children's hospital in Ohio is seeing a record number of kids admitted, mostly from swine flu. Out west, nurses in California and Nevada are planning to join a one-day strike, fearing hospitals aren't doing enough to deal with the virus. And in Florida, some news there. State officials are working on a plan to potentially ration certain medical care in the event of a swine flu pandemic. So we need to talk about all this, and for that we bring in our senior health and medical editor, Dr. Rich Besser. Rich, let's start with this kid in the ER room in Ohio. What do we know about ER rooms in general? How are they dealing with this?
You know, what we've been seeing over the past couple months is big waves of flu in different parts of the country. Last month, there were tents being set up outside of emergency rooms in Austin, Texas, and Memphis. It lasted for about a week, and then the wave went away. And it appears that's what's happening now in Ohio.
All right, so that's what we're seeing there. The news today is this Florida plan. Right. What is going on there? What do you think it means for other states?
Well, what was released yesterday was a draft plan from Florida on what to do if the medical system was overwhelmed. This is a really good thing. The time to do that kind of planning isn't when you're overwhelmed. It's before you're overwhelmed. So you can talk about how do you provide additional services for the patients you're going to need, where can resources come from, and what do you do if you just reach the end and you don't have additional ventilators or other care to provide.
And that's where it starts to get critical, right? Because the idea of rationing scares a lot of people.
That's right. You know, in 2006, Congress passed legislation requiring every state to do this kind of planning and gave a lot of money. Planning for things like how to distribute vaccine, how to distribute Tamiflu, but also how do you provide medical care in the event that it's a 1918-like pandemic. So what Florida was doing is not in response to swine flu, it's in response to general pandemic planning.
From planning that was given to them in 2006, they should look at it. You're going to see this in other states?
Yeah, every state is required. Every state has done this. Last night I was talking to Dr. Nicole Lurie, who's the Assistant Secretary for Preparedness in the Department of Health and Human Services. And her perspective, this is great. In the event that Florida was swamped, federal resources would come in, assuming that the entire country is at the same level. Many things would happen before rationing would take place, but the discussions now with doctors and with the general public to weigh in on these aren't medical decisions, they're societal, ethical decisions. This is the time to have those discussions.
So to see it in advance is not panic, it's showing the right urgency, letting everybody get on board.
That's right. Florida's plan was to share it with doctors and then have community meetings and talk about, is this the way we should do this?
All right, it's good to know, Dr. Rich Besser. Thank you very much. Appreciate it.